ahead and get started. I think first up is announcements. Desi, I'm guessing?
Yeah, thanks everybody and good afternoon. Just a couple of things. Wanted to let you all know that we finished up interviewing for our health officer position and had a really strong applicant pool, which was great. Our top candidate that we selected was Dr. Tracy Newman. And so we will be sending that recommendation forward to the City Commission meeting on June 1st. And then pending that approval would be a start date of June 15th. So obviously we talked about if that approval goes through, you know, the need for probably best for Fargo Public Schools to send us a new representative, you know, starting in June. So that will be our plan going forward. So we're really excited about this new prospect. So thanks for everyone who was involved in that interview process. It went very well. The only other thing I was going to mention was just a quick update on my status. I'm finishing up treatment in Minnesota, and I'm hoping to be released from care back to Fargo on June 9th. So, and then I will have to be cleared at some point to be in a human environment again. So we'll see. Otherwise, I will be working remotely as always. So I'm accessible by email or phone anytime. So just reach out if you need anything. That is all I have.
Thank you, Desi, and best of luck in the transition back here. So excellent. And then congratulations, Dr. Newman. Excited to have you on board. Almost officially. Okay. I think next on the agenda is the approval of the minutes from April 16th. Do I have a motion to approve those?
This is Dr. LaValle. I motion to approve.
Thank you. Do I have a second?
Oh, Arlette Preston, I'll second.
Thank you, Arlette. All those in favor signify by aye.
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 Any opposed? Okay. Minutes are approved. And so I think the main agenda item today is the 2022 budget. So I'm guessing that is Melissa.
I'll start us out and then Melissa can take the reins after that. But just so you probably saw from the attachments that Lori had sent out that our process was a little bit different this year. The city had wanted to standardize the process across all of the divisions. So there was a new template that they had incorporated that really looked at personnel costs, operating costs, and capital costs. So you will see that those are broken down in how we requested for our agency. Most of our requests were to help support the harm reduction division. So you'll probably see that going through as well. But if you have questions as Melissa goes through, just please speak up and we will try to do our best to answer what we can. Go ahead, Miss Melissa. Thanks.
All right. Hello, everyone. And I should say hello, ladies and Larry. If I'm seeing everybody on the line so far. So I'm going to share my screen and I need to pick the right one here. Let's see, I'm going to share the numbers so you can see them as I'm talking about them. And somebody want to let me know, can you see them?
Not yet. Oh,
I can see them.
there we go. There we go.
Okay, good. All right, well, I have in front of you on the left-hand side of the screen, well, at least on my left, the revenue budget and then the city template, which we'll talk about both of these things. I need to move something out of the way here. There we go. So as Desi said, if you have any questions, just let me know. The majority of our budget, which you'll see on the operating side, is salary and benefits, and that represents 86% of our budget. Most of the remaining operating budget is dictated by the funding we receive. So given that information, we're going to look at the revenue first and kind of walk through that. So we'll start with that first section, which is the grants. It's federal funding. Everything listed there is federal funding that flows through the North Dakota Department of Health. We don't expect many changes in this current listing of funds, except for line 18, which is the MCH breastfeeding obesity grant. We just recently found out that our funding starting in October could disappear entirely, which we're hoping is not the case. There'll be more information coming. We're hoping to maybe decrease that to 80,000. It's not reflected in this budget yet, as we hope to hear something either on that or a different funding similar before the budget process is complete. I'm going to jump down to that last line, the CARES funding. So our CARES funding, which you only see a portion of here because it covers both normal operations and all the overtime expenses, and all the actual expenses show up in a different fund. So not general fund for the city, but Fund 411, they call it. I'm not sure what their title is for that, but that's where those numbers show up. So you're only seeing the revenue that impacted our regular standard salary and benefits. So our CARES funding ends June 30th, and we will have spent all of the local health portion, which was $3 million. We also had task funds of $9 million, of which I expect we will have spent $7.5 million. A good majority of that was through planning and the efforts they did last summer, fall, winter. Currently, we have a $600,000 COVID grant from the North Dakota Department of Health, and we will be receiving an additional $600,000 for continued COVID work. This grant ends November of 2022. So that's $1.2 million that will start now July 1 and go through November of 2022. In addition, we will be soon getting a $2.5 million grant for an immunization health equity grant. That runs through June of 2024. I don't have the specifics on that grant yet. So more to come when we know what that all looks like. We will be receiving a grant for $1 million for ESG COVID dollars, which is emergency solution grants, and that's specific to homeless. And that funding ends September of 2022. And I'm not sure yet if the ESG COVID funding is federal or state, so it'll show up in one of these two areas. The second section is the state grants. And that's funding we receive from either the North Dakota Department of Health, Department of Human Services, or the Department of Commerce, which is our Gladys Ray Shelter funding. Two items to note there is the tobacco prevention funding was decreased by roughly $100,000 for a media campaign that will now be handled by the state going forward. And I'm not 100% sure if that's the state or Upper Missouri who used to handle the media campaign, but that's where it's going. We also have received $604,000 from the Department of Human Services for our mobile outreach program. And I highlighted that line item of $302,000 because it's $302 this year and $302 next year, full years, which will cover the, as I said, mobile outreach. So that's fantastic funding for that program. I've added it to this spreadsheet because that was a conversation we had with the finance department, and that's how they wanted us to handle it. They're taking care of it on their end, and it will be added to our numbers that we had submitted earlier. The next line item is state aid, and that is not changing as far as we know. July 1 is the new biennium, or I'm not sure where we're at with the biennium. Can't remember if it ends this year or next year. Anyway, not changing, but that supports a variety of our programs in the health department. Under the local funding, the top line is United Way, and that is for the Nurse Family Partnership Program. They are decreasing their contribution in 2022 down to $34,000 and no funding expected after that point. This was part of the funding plan, has been in operation for a while. We're doing a step down from them. We just received word that we will be again the service provider for Fargo Public Schools for their nursing, and we will continue school nursing in the county schools. So the increases you see here are reflected in the budget. That's for staff time. And I think we increased time slightly in the schools. And of course, for the nurses that are on the pay scale, their steps go up. And so that increases that. Self-pay, we didn't have a lot of changes there, but that consists of client services in programs, family planning, adult health, lab that is for the employee health part of the world. Under insurance and Medicaid, we have a slight decrease, but of course, both self-pay and insurance and Medicaid a little bit hard to predict based on 2020. So it's hard to say where those numbers will fall out in the end. Going on down, I'll pass miscellaneous because that's truly what it is. Cass County, we contract with Cass County for services provided outside of the city of Fargo and for nursing services at the jail. The increases you see here are due to staff annual salary step increases. The next category of funding is environmental. That is mostly self-pay again. It's license fees, pool, like it says, pool water testing fees. We don't expect a lot of changes there. Or under the final section, which is fines. And that VIP is Victim Impact Panel program. And TIP is the teen tobacco program. So currently, the way it sits today, we have estimated increase in revenue of $289,000, which will go up significantly based on the grants that are still coming in. A lot of money is still coming in, but we don't have those contracts yet. We don't know what they're going to look like yet. So it's really hard to do a budget adjustment or even include it in our budget right now until we actually see those contracts. So that's where the revenue is going to end up. Anybody have any questions on the revenue side?
Any questions? I know we had some discussion, I guess, last year on some of the fees associated with environmental health, and they hadn't been increased for a long time. And so we made an adjustment there. I think that was last year. So no adjustment this year then to that. Just
not currently. And then the other issue is the city, refunded because of COVID a fair amount to the businesses. And then the other thing, of course, with COVID, we had a lot of closures. So we don't really know where that's going to end up. And right, the annual increases, or I don't know if they're annual necessarily, but the increases, Grant has a, kind of an idea of how that works. So I don't think he's not on the call today, but.
okay.
Chelsea, this is Arlette. I have a question.
Sure.
So, Melissa, this isn't really a finance question, but I'm interested in the nurse family program. You said that the funding was intended to go down from that and slowly go away. Is that right? Or
Yeah, I can speak to that, Arlette. So United Way was a really strong supporter of the Nurse Family Partnership Program, and they still are, but they aren't intended to be like a long-term funding source. So we knew going into a partnership with them that they would help initially, and then we would kind of absorb that into our budget ongoing. And so that's kind of why that is decreasing.
okay, so is the program going to stay? It's just the funding source is moving over to the city. Is that right?
Yeah. So the program is still up and running and going strong, and
Okay.
we're just kind of finding other sources for funding.
If I could suggest perhaps for a future meeting, I don't know much about that program. It would be interesting to hear a little bit more about it.
Absolutely, we can put that on the agenda.
One other question. Alcohol compliance is not much funding there. What does that go towards?
I'll have to, if Larry's on, if you're still on, Larry, do you want to take that?
Yes, I believe that is the fines for for different businesses that fail the compliance checks. The unfortunate part is we're struggling with doing up to 4 times a year for each of the 200 liquor license establishments. So moving forward, I hope that we're able to do more. So that's actually a good sign that there's not a lot of fails, but in all honesty, we have not checked many of the businesses more than maybe once. Some we haven't even checked. So currently we have we have a alcohol compliance check scheduled for June 16th, and then those failures, those fines, I believe, are the ones that are listed on this spreadsheet.
Okay, thank you.
And then Arlette, to answer, to go back to your one question about nurse family partnership, that was home visiting was also part of the American Rescue Plan. So I did submit to Kent some information on the portion of the NFP program and a few other areas in our budget that could be supported by that or already have expenses for, say, this year. I think that funding starts March 2nd. So I did give him some numbers. They don't amount to much for us because Nurse Family Partnership, we also bill Medicaid, which we get about $5,000 a month from those Medicaid clients. And now I can't think of where the other 5,000 comes from. Not off the top of my head, but there is an additional 5,000 that supports that program. So our costs for that program are about $30,000 a month. So I gave Kent that $20,000 difference, and for the rest of this year. And of course, I don't know when the American Rescue Plan fund ends either, but that could continue into next year. So I don't know what'll happen with that, but that's where I left it with him. So anyway, you can follow up if you wanted to. So.
I just have a follow-up to that. So thanks, Melissa, for the additional information on the nurse family partnership piece. My thought would be that there's additional funding out there just with the emphasis in home and community-based services. So good to know that, inquiring about those federal funds. The other question I had is for Larry in terms of capacity. Is that what's driving the lack of ability to monitor those alcohol establishments? Is it police officer time, or is there anything that complicating those efforts?
Yeah, that's a good question. The biggest barrier and roadblock that we're currently having is that our law enforcement agency is spread so thin that it's challenging at times to coordinate officers and youth. Ideally, we would like to do more youth compliance checks using youth to go into the establishment, hoping that they do pass. I do know, in talking to our current police chief, that there are walkthroughs, and if people want to call those compliance checks, they're a little different because they don't use the youth, but they do identify if somebody looks like they've been overserved or someone looks young. They'll ask an individual to see their license and so on. And I believe moving forward that there's going to be more documentation to show that during the officers' beats that they are actually looking for a variety of different issues related to over-serving and underage serving and so on. So I know I have a meeting that's going to be set up with the police chief just to talk about getting officers, because we're hoping to have compliance checks in June and more often. So businesses are checked at least once a year, hopefully some 2 or 3, especially if they do fail a compliance check.
Okay. Thanks, Larry.
Yep.
Okay, so if there isn't any more questions, I'll head on over to the operating side. I'm assuming you can still see my screens because I haven't stopped sharing them yet, but I'll move to this section and also this part of the budget or this template. So as Desi had mentioned, the city implemented a different process this year, which included a template for the operating budget, and that had to be submitted by May 3rd of this year. Using this template allowed us to include some narrative and the ability to code our expenses as discretionary or non-discretionary, and if they were one-time, reallocated, or reoccurring. So I listed all grant-funded expenses were listed as non-discretionary, which will help the budget team understand how our funding is tied to the operating budget. The reallocation process allowed us to move line items around internally, giving us a more accurate budget in each line and division. Then we met with each division director in early April, which this year happened to be a month earlier than the last few years. And we ended up looking at our budgets based on 2019 expenditures instead of 2020. As we all know, it was very disrupted. So overall, the majority of our operating line items were reallocated, which I can show you in this template. We have a one-time request for 2022 for $5,000 for strategic planning, and the only reoccurring line item listed is for $100,000 for ongoing expenses in harm reduction, and that's covered by the state opioid response grant, which is SOR is the abbreviation for that. Our overall operating budget increased then by $40,000. The largest decreases were interpreters because of the decrease in New Americans, and in contract services, which is mainly due to that tobacco prevention change. Our largest increase is in the harm reduction program, and while it's covered by the SOR grant, it was not in our budget this year, so we're asking that to go forward. So this is the template on this side of the screen. You can see all the, on the left, you can see all the expenses. It's by total department. I won't go through each line item unless somebody has a specific question on that. But the template they did, which actually was kind of nice, a few quirks need to be worked out, but it actually worked pretty darn well. It was a little bit of extra keying for the year, but that's all right. So we have a cost, we have the budget summary page, which comes from the personnel page that all flows into here, is the cost of our new FTEs that we are requesting. And if you looked through this information, we had new requests this year were for staff differentials, shift differentials for the harm reduction program. We are requesting a medical and coding staff person for harm reduction and an RN to work at the harm reduction, in the harm reduction area. And we also requested an office associate in admin to help with everything that goes on in the building. So that total was $219,000. And then the cost of reclassifications, which included 2 temporary staff in harm reduction going from temp to full-time, and the WIC staff, there was a change in the legislature on their licensing, and so that request also went in, and that would go into effect actually beginning of August. So that's the cost of that reclassification. Our one-time operating expense, which I had talked about already, is the strategic planning. That was $5,000, and then it nets out here to $40,000. Let's see, our capital requests were just ongoing things for the building. Nothing too major there. Doesn't amount to a whole lot for the next year. We requested for next year to replace some refrigerators as they all, they die randomly. Maybe a light notification system for WIC. They have that now, but it doesn't function very well. It goes out a lot. And then to replace a few of our pieces of equipment in the building. If funding remains at the end of this year, some of that could happen this year instead. So we kind of play that by ear. That is kind of all of our budget in a nutshell. So if anybody has direct questions, I'll quit sharing the screen for now. If anybody has any questions.
Any questions for Melissa?
Can somebody talk about the strategic planning line item? $5,000 doesn't sound like much.
Yeah, I can, Arlette. So we haven't formally done strategic planning for 10 plus years. It was back when Mary Kay was here. So we wanted to bring in a public health consultant from out of state. And so we actually got some names and some quotes from our colleagues in Grand Forks who have done the strategic planning. And so that just included, a couple day event and then air travel and lodging and stuff to bring somebody in. So that was the cost that they quoted us. So we just went a little above that so we would be able to bring someone in.
So you're talking strategic planning just amongst the staff in a one-day kind of session?
Yep. So probably 1 to 2 days of just internal staff looking, and we may ask the Board of Health to participate in that as well, but just to look at, our current programs, what we're doing, is that, what the needs of the community are, and just kind of to prioritize what we're doing. And so, yeah, it kind of is, it's not a large community needs assessment. It's more of like an internal planning process for us.
So how does that tie into the community needs assessment that's going on?
Well, that would be data that we would use to probably drive what the community needs are and what our programming needs need to be.
Okay.
So what kind of timeline are you? Thanks, Arlette. What kind of timeline are you looking at for doing the strategic planning pieces? And does that align to Arlette's question with the community needs assessment and getting that data to help drive that?
Yeah, I suspect that the strategic planning will be later because, the community health assessment, a lot of that should be happening in the summer. And so probably we would wait more till later fall and, in hopes of kind of wrapping up some more of the COVID activities as well. So everybody can kind of refocus back on what our priorities should be.
Excellent. Well, let us know if you want participation. I'd love to participate in whatever capacity you think is appropriate.
Yeah, no, that would be very helpful.
Other questions? We didn't have a line item for miscellaneous, so I'm not sure if you want any other topics to come up today or if we should wrap up, but anything else that folks have? Okay, if not, our next meeting is August 13th. And so we'll see you all there. Thanks, everyone.